Welcome to chapters 21 and 22, Lymphatic System and Immunity. This is the part 2 video for this section. In the previous lecture, we did talk a little, just alluded to a little bit about autoimmune disorders. This is where the immune system is mounting a response against tissues and cells within the body that would normally be considered self. Depending on which organ systems you're talking about, you can have varying degrees of severity from annoying to life-threatening. So things like multiple sclerosis, Crohn's, type 1 diabetes, systemic lupus erythematosus, or just lupus, rheumatoid arthritis, and spondylitis, which attacks the spine. Sometimes it's mistaken for bone mass loss, though that is a symptom. Okay, so osteoporosis, if you will. This one is more serious because it's an autoimmune condition. So here's a classic example of rheumatoid arthritis. RA is actually occurs, when in other classes that I've taught, we've compared osteoarthritis to rheumatoid arthritis. Osteoarthritis is actually a use-dependent disorder caused by use and flexing and impact and occupation and so forth. Rheumatoid arthritis can happen to somebody who hardly uses their hands or anything along those lines at all. It's an autoimmune disorder that attacks the joints, and it actually occurs in younger patients and is more painful and severe at an earlier onset than osteoarthritis. And here is an X-ray of the lumbar spine and upper pelvis of a normal patient compared to that of an ankylosing spondylitis patient. It's not unlike what we see in rheumatoid arthritis, though it's the area where the autoimmune attack is occurring. That's the main difference between AS and rheumatoid arthritis. And because the immune system can be a little bit confusing, we've worked up some resources for you. If this video is not enough for you, the reading or other things, do what you can in order to learn this stuff. And so we have 3 or 4 different YouTube resources: Ninja Nerd, Dr. Matt, Dr. Mike, Osmosis from Elvisier, and Alila Medical. These are all really, really good resources. Some are longer than others, worth your time. The tissues and cells that comprise what we call the immune system include 3 major vascular systems. Arteries and veins, the lymphatic system that we have here, and then there's a third one that was just recently been discovered over the last 10 years or so called the glymphatic system, which is really, really important during sleep. In any case, the lymphatic system is where we see a lot of immune activity. You have a vein-like vasculature that has these nodes and special organs that work to circulate the cells that are what we call immunocompetent cells. These are white blood cells, lymphocytes, and other cells that are associated with surveillance and response to pathological infection. So we have the lymphatic system, and there you can see the network here. And again, part of the lymphatic system is to return extracellular fluid back to blood plasma after it's leaked out of capillaries. Capillaries lose about 3 liters of fluid per day net, and that needs to be returned, otherwise it'll hang up in the tissues and cause edema. We also have those cells, and those cells tend to mature and be developed and differentiated in red bone marrow, along with the thymus, which is found up here, just posterior to the heart in this region. We also have these specialized structures that are located within and along the lymphatic network for screening and surveillance of potential pathogens. These include these small lymph nodes. Lots and lots of lymphocytes reside in lymph nodes, just sitting there, letting the fluid pass by them, looking for antigens or perhaps an antigen-presenting cell that's going to activate them. You have the spleen, which is in particular, and see the spleen's right here, in particular is involved in screening out and recycling aged out red blood cells. Red blood cells do have about a 4-month lifespan, and when they get old, they get kind of raggedy and they start showing proteins that they shouldn't. The spleen's really good at recognizing it, along with the liver too. So if you happen to lose your spleen for some reason, the liver can kind of carry on. Mucosa-associated lymphoid tissue. What we're talking about here, Peyer's patches in particular. This is from our digestive tract lectures. We talked about Peyer's patches. And lastly, the appendix. Now we have tonsils and we have other things. Those are specialized, those are lymph nodes, all right? Adenoids, the same sort of thing. The appendix is an important lymphatic organ that we don't often normally associate with immune response. Here's a nice comparison between the vascular, or shall we say cardiovascular system, because the heart's involved, arteries and veins, and the subsets of those vessels, along with the lymphatic system. Of course, we have the glymphatic one too. I kind of have a little bit of a crush on the glymphatic system, I guess, but it's mostly involved in sleep. But here we have a nice comparison between these two. And here is a list for you of the components of the lymphatic system. I'm not going to elaborate too much here for time reasons. Same thing here for the functions. We've talked about this already. Fluid recovery, certainly immunological screening. All right, this is we pass the lymphatic fluid through lymph nodes and organs as a surveillance function for potential pathogens. And then lastly, that we haven't talked about is that there are specialized lymphatics in the digestive tract. I may have mentioned it during digestion, that there's specialized lymphatics called lacteals. They are in fact lymphatic vessels that infiltrate the small intestines and are involved in pinocytosis, that is absorbing lipid droplets in the digestive tract. One of the reasons why during a normal, like for instance, a breast cancer screening, the clinician will often feel under the axilla and in the armpits of the patient is that if cancer cells begin moving through the body, they oftentimes will hang up in lymph nodes. And so since the breast is near the axilla, one of the most proximal lymph nodes where these cancer cells will hang up is that axillary lymph node, just in the kind of the front third, kind of that first deep spot in your armpit is where this axillary lymph node is located. So that's an example of a filtration. They will capture and retain foreign particles or potential pathogens in these lymph nodes, including, like I said, cancer cells, and will destroy them if possible using macrophages and other types of cells to do so. Now, lymph is similar to blood plasma, but with less proteins, has less proteins, but it does have cells. So unlike blood plasma, which has liquid, proteins, and cells, interstitial fluid has relatively little protein, but in the case of lymph, you have the addition of cells, along with material from the fat absorption called chyle. These are small droplets that are sort of encapsulated in lipid bilayers in vesicles and so forth. You may have pathogens in there and cancer cells. These are all things that are sometimes found in lymph. Due to the mechanics of development and the fact that lymphatic vessels arise from the same precursor cells that arteries and veins do, what we see is the lymphatics tend to run in a kind of a parallel fashion to blood vessels. Because lymphatics are extremely low pressure, there's very, very little pressure. There's very, very little resistance inside these lymphatics as well. Because they're lower pressure, the fluid will, by virtue of the fact that fluid is escaping from the arteries and in the capillaries, if you will, because fluid is continuously escaping from the capillaries, there tends to be a slightly higher pressure in the tissue, which means that the fluid will migrate in due to this hydrostatic pressure and flow away. So it's a pressure gradient, if you will. And because there's so low pressure in the lymphatics, you don't see fluid escaping in the same way that you see in the arterial capillaries and so forth. Again, the specialized ones in the intestines, we call those lacteals, and those are the ones that are absorbing fats. And here's a picture of the lacteals. You see this microvilli that we see on the surface of the mucosal cells in the small intestine. Zoomed in, you certainly have blood vessels, but you also have those specialized lymphatics. In lymphatics, like veins, like I said early on, vein-like structures, lymphatics do have semblance of valves similar to veins. The significance of lymphatic trunks is that occasionally what will happen is you will get some kind of an occlusion, or in cases of trauma, where one of these trunks will be occluded and damaged, leading to regional, what we call lymphedema, where the lymphatics are no longer draining the tissue properly, and so the fluid begins building up in those areas. And they're basically named after the area where they're located. So these shouldn't be too hard, right? So you've got a lumbar one, that's the legs and the pelvis. You've got the abdominal one, the bronchomediastinal. That might be the one that may be the most difficult. Subclavian, jugular, intercostal. Again, they're just named right after the regions that they serve. All of these major lymphatic trunks do collect together in two large final ducts. They're sort of analogous to vena cava, but not exactly in terms of their shape, if you will. You've got the right one, which is sort of right under your right collarbone. That's called the right lymphatic duct, and it's worth about a quarter of your lymphatic circulation. And then you have a bigger one called the thoracic duct, 3/4 of your body. Again, right sort of underneath, more central and underneath your left collarbone. And so what we see is that's the typical structure, if you will. And you can see a typical structure that you would find in a person in terms of the lymphatic ducts. Now, I didn't talk about it in the previous one, but there's this thing called the cisterna chyli. It's found lower in the abdominal area. It's part of the drainage off of the lacteals that then eventually goes up into the thoracic duct. And here's the breakout of the areas served by the major lymphatic ducts. You can see about a quarter and 3/4. Those lymph nodes that we were talking about in terms of palpation, the submandibular one is important for things like infections or certain types of lymphomas. You have a cervical one. Axillary is very, very common, then inguinal down in the pelvic region. Other ones that may show up on x-rays or other types of advanced imagery, the mediastinal and the intestinal, those are non-palpable. So a little bit about the function of lymph nodes. We've already discussed this a little bit. They serve as screens. And so we have all different kinds of cells, T cells, B cells, dendritic cells, antigen-presenting cells, lymphocytes, and so forth, macrophages. They're just sitting here waiting for fluid to pass by that may have antigens or perhaps cells that are presenting antigens in order to trigger immune activation, cell-mediated immunity. For instance, if the B cells become activated, they will differentiate into what we call antibody-producing plasma cells. This is what happens in lymph nodes. Now, if lymph nodes are activated, you see lots of cell proliferation. You may see cells migrating to that area, and the lymph node becomes enlarged, what we call a lymphadenopathy. That is, and you can actually palpate it. For instance, if certain types of lymphomas, you'll have enlarged lymph nodes right under the corner of your jaw, right there. Normally, they're supposed to be feel like little peas in there, little small nodes. And if they are more like malt balls, that's a sign of that something's going on and might need some further investigation. And here we have the thymus, again, which is found just sort of posterior to the heart and actually shrinks over the lifespan of the patient. Thymus actually gets smaller and smaller with age. It does produce signals, hormone-like signals, as well as cytokines. It's hard. These lines are blurred here a little bit. They're calling them hormones in this situation, but they do have properties similar to both that will then trigger lymphocytes to become immunocompetent, to differentiate and specialize in order to meet the pathogenic need. Again, it's found right in the heart region, between the sternum and the aorta. All right. This is where you find T cells. This is where T cells mature. This is also kind of where you develop lack of sensitivity. For instance, we know for a fact that young people who grow up on farms have much fewer incidences of allergies compared to people who live in cleaner environments. That is, you develop a tolerance to certain potential allergens, and that seems to occur in childhood, and very very early on in the lifespan. But over time, it slowly atrophies, and that may be the reason why in much older years you begin to get you tend to be more sensitive or more susceptible to infections, especially past the age of, say, 80. So here's an example of mucosa-associated lymphoid tissue. These are ones that are directly visible with the inspection. Malt, all right. These are tonsils. Can't see adenoids, but you can see the palatine tonsils. You might catch the pharyngeals if you're lucky and you're good at it. And if you happen to see them enlarged, the lymphadenopathy of the tonsils, tonsillitis, okay. Here's some information about the spleen. It's found posterior to the stomach, anterior to the kidneys, kind of in and around the pancreas and part of the transverse intestine before it begins descending. Really, it's a lymphatic tissue, but one of the major things that it does is it helps recycle hemoglobin and aged red blood cells. It's actually the largest lymphatic tissue in the body. And so I've already mentioned this already, so we've got it in text form here. It just like the other lymph nodes and lymphatic tissues in the body, it's a filter. It is involved in the iron cycle of protecting the body from unregulated iron, so it keeps iron under lock and key. It does destroy old red blood cells. That's what we call the red pulp. It's also a site for production of antibodies, what we call the white pulp. And a little bit getting close to the end here, wrapping up a red bone marrow. It's involved in that process of hematopoiesis, in particular red blood cells and what we call granulocytes and or early stage lymphocytes. Lymphocytes will develop initially in the red bone marrow and then move on, all right, move on to the lymphatic system where they will become fully immunocompetent. So they're precursor cells in the red bone marrow and then will migrate and deposit in the lymphatic tissues of the lymphatic system, particularly the nodes or the thymus or the spleen or the Peyer's patches, etc., where they will then become fully immunocompetent. And just a question for you, where is red bone marrow located? We find it in the interior of long bones. And we did mention this, way earlier in the lecture, the idea of natural killer cells versus cytotoxic T cells. NK cells are part of what we call the innate immune system. They're always around. They do not require any type of induction event to occur. Whereas cytotoxic T cells are specific. They are set up to target cells that express that one specific molecule we call an antigen, and have to be induced through that antigen presentation mechanism. We haven't gone into huge detail on that presentation mechanism, but that's the difference. And I think this is a nice wrap up as the final slide. This is an example of innate. This is an example of adaptive, doing kind of a similar thing. And this wraps up part 2 of the lymphatic system. I hope you've been able to pick up some information. If not, please do get out there into the resources, the book, other videos, ask questions. Glad to help out where we can. Thanks for your time, and I will see you in class.